Okay, I'm just going to get started. So thank you very much, everybody, for joining this session, which I'm really excited about. My name is Ruth Patterson. I am Chair of the Innovation and Pedagogy Group at Council of Deans and Associate Professor at Edinburgh Napier University. And I'm sure sustainability in healthcare education is at the forefront of lots of people's minds because of the global challenge around climate change. And so this session is really focused on this, and I just wanted to talk a little bit. Oh gosh, I've lost my screen. Hold on. I just wanted to talk a little bit about the work that we've been doing at Council of Deans that has really sort of allowed us to sort of focus on this in this session. So in October 2024 at Council of Deans, we had a workshop that really, that was our education leaders in Council of Deans had really asked us to look at. And that workshop really focused on the challenges and opportunities of integrating environmental sustainability into healthcare education and the role that higher education institutes played in advocating for and implementing sustainable healthcare practices. That's led us to think about what we can do as an innovation and pedagogy group around sustainable healthcare and share good practice. And this is what this webinar is about. It's about sharing good practice on how HEIs have developed and implemented innovative approaches to promote sustainability in healthcare education. So to really sort of stimulate that debate and that discussion, and to really showcase how institutions have done that very, very simply and successfully. And we'll also look to the future and consider opportunities to collaborate and embed environmental sustainability in healthcare going forward. And of course, this is part of our Innovation Month this month. So without further ado, I'd like to introduce our speakers. We have Dr. Ayoma Ratnappuli, who's a Quality Improvement Education Fellow at the Centre for Sustainable Change. We've got Lucy Brown, who's the EU Horizons Clinical Delivery Lead at the Centre for Sustainable Healthcare. And we've got Dr. Lorna Johnson, who's a reader in physiotherapy education and head of academic teaching in the Department of Physiotherapy at King's College London. So thank you very much. I'll hand over to the team, starting off with Ayoma to do their presentations. If you have got any questions, we'll take them at the end. Please just put them in the chat and we'll pick those up at the end of the session. So thank you very much. Okay, over to Ayoma.
Thank you, Ruth. Hopefully you guys can see my slide. So I'm Ayoma. As Ruth introduced me, I'm the Education Fellow for the Centre for Sustainable Healthcare. I'm also a Sexual Health and HIV Specialist Registrar in London. And I'm really pleased to be joined today by Dr. Lorna Johnson, who's a reader in Physiotherapy Education at King's College London, and my colleague Lucy Brown, who's Clinical Delivery Lead from the Centre for Sustainable Healthcare as well. And today we're going to be talking to you about innovative practice and sustainable healthcare education. So just to introduce who we work for. So we work for the Centre for Sustainable Healthcare. We're an independent non-profit organisation. We work to really try and empower and inspire and equip healthcare professionals and organisations, those being either healthcare delivery like NHS trusts or educational organisations like universities, with methods and metrics for sustainable models of care. So we're trying to really drive sustainable net zero care to the forefront. We have multiple programmes, so it includes Green Space for Health, which includes NHS forests. We have sustainability analyst teams. We do green teams competitions and specialty challenges. But the programme we're really going to try and focus on today is our Sustainability and Quality Improvement Project programme. I'm not going to focus too much on why this is important. I think students and educators alike agree this is an area that needs to be embedded in education and training. And progressively, we're seeing inclusion of climate change, of planetary health, and sustainable healthcare into pre and post registration curricula across all healthcare disciplines. And there's just a couple of snippets from some organisations supporting that. But what really remains to be outlined is what should be included and how should we include it. There's already so many competing priorities, curriculums are jam-packed. We would argue that students need more than just knowledge. So understanding the relationship between healthcare and climate change, alone isn't enough. They need skills to make positive changes, to make their work more sustainable. But educators need guidance on this. As Ruth said, we need to know what is the best practice, what are the challenges that you may face, and how do you overcome these? The Medical Schools Council created an Education for Sustainable Healthcare curricula in the UK, but what about other health disciplines? So we believe that integrating sustainable healthcare knowledge should be longitudinal through courses in the same way that we talk about things like patient safety and professionalism. So for example, you can highlight the risks of climate change on different body systems. You can explore the public health effect of environmental degradation. You can talk about climate justice when we teach about health inequalities. Those are all examples of an integrated approach. But when it comes to skills and empowering students, we need to give them tools to make change. And we believe that by integrating sustainability with quality improvement, which is a common standard of proficiency for healthcare professionals, that's a really effective way of doing that. So when we think about traditional QI, we very often measure that with clinical outcomes, sometimes with financial outcomes. But the difference with SUS-QI is we look a little bit more holistically. We think about outcomes for patients, but also for wider populations. And we also have to consider what are the environmental, social, and financial impacts of that healthcare service, process, project that we're evaluating. Unfortunately, learning about SUS-QI takes a whole other workshop, so we're not going to go into a huge amount of detail, but this is the framework that we really try and champion and that we find is really effective. And we have done evaluations to look at how learners felt learning about sustainable healthcare and SUS-QI changed their understanding. And I've put 2 QR codes to 2 papers that have been published in relation to this. And if we start off looking at the bar charts of comparisons, we've got self-reported from the learners pre-session and post-session, their knowledge, their confidence, and really their motivations. And what you see is pre-session, there's very little knowledge or confidence in regards to sustainability or quality improvement, but there was already pre-existing motivation to want to reduce their environmental impact in their future work. But after session delivery, so this was very often over COVID, so there was lots of video conferencing, online workshops, short lectures, small breakout room sessions, all on sustainability and SUS-QI. You can see that there's a huge increase in their knowledge, in their confidence, and also self-reported they're more likely to be involved in QI projects in general. I've also just included a quote from the second paper, which is Concrete Ways We Make a Difference. And I think it really concisely shows the beauty of SUS-QI. It's easy to feel hopeless with the news of climate change, and SUS-QI is a valuable way of giving concrete ways in which we can make a difference rather than just learning about the problem. So I'm going to show 2 examples of, organizations that we've partnered with to integrate sustainable healthcare within their education. So the first one is Oxford Brookes University. This was occupational therapy, and they were a beacon site a couple of years ago, so before my time, but they really used the spiral curricula, as we said, to longitudinally embed sustainability in SUS-QI. And it culminated with a final year leadership and management module assignment where they had to develop a service improvement project, which had to include SUS-QI principles and concepts. And I've also included some of the learning objectives that they used to do that. We've also partnered with King's College London Faculty of Nursing, Midwifery and Palliative Care. They have been with us for a very long time. They were original pilot site as well. So leads were upskilled through courses led by CSH on SUS-QI and teaching SUS-QI. There they learned about how to use our educator pack and evaluation tools. The leads then went back and looked at their modules and identified where sustainable healthcare would fit and incorporated learning objectives and assessments and also project templates for marking. So it's now expanded quite a lot in their faculty. So it's now across all of their programs, pre-registration, and bachelor's, master's, and advanced clinical practice as well. And I've included a photo there of some of their students who underwent sustainability workshops and won the Outstanding Contribution to Sustainability Prize at the Student Nurse and Time Awards last year. So they had embarked on projects on clinical waste production in clinical skills labs. and also the sustainability of the student nurses' uniforms as well. So what we see through their example is the impact of the education that they have been providing. And so I'm going to hand over to Lorna, who is one of our Academy programme partners. So the Academy programme is a kind of tailor-made membership where we support organisations to embed sustainable healthcare within their either education or their training. And Lorna's going to give her sort of real-world experiences of how she's been finding that process. So I'll hand over to you, Lorna, and just let me know when you want me to change the slides.
Lovely, thank you very much, and thank you for inviting me to talk this afternoon. If we can move on to the next slide, please. Thank you. The background to this project is that King's relaunched two new pre-registration physiotherapy curricula in 2021. And those original curricula were designed in partnership with stakeholders, including students and wider stakeholder partners sort of from practice and King's Academy. And we aim to train physiotherapists who will be future leaders in both delivering healthcare and research. Aspects of sustainability are already integrated within the programmes, and I've just sort of given some very sort of simple examples where students are guided to adopt a patient-centred approach based on the ICF that does, of course, consider environmental factors, and we think about lots of aspects of sustainability when thinking about the impacts of global warming, for example, or thinking about health inequalities. But there was definitely lots of scope to do more work in this space. And this current project was funded by an internal fund, which is the Education for Sustainability Fund from King's, which is sort of being developed to try and embed sustainability in all the programmes across the university. And so the project that I led was a collaborative project with Central London Community Trust, who takes a lot of physiotherapy students on placements from both programmes. And as part of the project, we included some funding to have some input from SUSQI and to be able to benefit from their expertise and resources. Can I have the next slide, please? So the objectives of the original project were to identify a real-world scenario focused on sustainability theme that would form the basis for a learning resource that could be developed in partnership with students. We wanted to increase staff and student knowledge and understanding about sustainability in healthcare by engaging with resources from SUSQI Academy, but also all the relevant literature that's available, and there is a huge amount. And then what we were aiming to do was to co-produce some teaching resources that would be situated within both programmes. And what I perhaps should have said earlier is that when we developed the programmes, we moved right away from any sort of siloed approach to sort of specialisms and just have themes of professionalism and leadership, physiotherapy practice that is not siloed, but sort of thinks about people as whole people, and also evidence-based practice. And so we envisaged that the sustainability teaching would be sitting in the professionalism leadership strand that goes through both programmes. Next slide, please. So this project was funding came through just under a year ago. And so the original plan was that we would arrange for students to start placements and to sort of have some real sort of explicit exposure to sustainability issues. But what actually happened was that the two of the key players, one of which was me, had to take some unplanned leave very unexpectedly. So the timeline of the project sort of changed slightly. So what we have done thus far is to recruit 5 student partners. And as part of their early work, those student partners visited CLCH to see sustainability work in progress. Originally, that had been planned to be part of a placement, but on this basis, the students just visited for half days and days over a period of weeks to sort of do some sort of research, if you like. 4 different students on the master's programme then completed placements that had a leadership and sustainability focus, as well as a clinical focus at CLCH. So those 2 pieces of work were sort of carrying on in sort of parallel, if you like. At the same time, the staff involved in this project, there was myself and 2 academic colleagues who I acknowledge at the end of the presentation, completed some training sessions with the SOS-QI Academy, and also started sort of engaging, researching the whole array of resources that are available, and sort of did a lot of mapping to sort of understand what information was out there and what information could be relevant to our programme. And sort of adopting that approach, we developed a lecture and an accompanying seminar that we co-produced using a backward design. So we developed the learning outcomes first and then sort of mapped everything backwards. That teaching resource, both the lecture and the seminar, were piloted in November 2024 with second-year students who were on a physiotherapy practice module. We've sort of taken a lot of feedback from those students, and we'll be delivering the next iteration in a couple of weeks' time. But what I've got at the bottom of this slide is one of the outputs from the seminar, which was attended by, I think in total, a very small number of students, about 12 students, thinking about what small change can you make as a physiotherapy student to reduce environmental waste in your clinical practice. And you can see from the sort of examples at the bottom of the slide, just a very, very small snippet of all the stuff that came out of these sessions, that people are beginning to think about those topics that might be very relevant or are incredibly relevant to physiotherapy students. So thinking about changes to transport, thinking about single use of products, and and things that might seem more obvious, like using digital resources rather than printing information, for example. Next slide, please. So having piloted the resource, we're due to deliver it, as I said, in March 2025. These are the learning outcomes for the seminar that's part of that teaching. So thinking about the healthcare and environmental impacts of sustainable clinical practice in a specific physiotherapy example. So the example we've created in this seminar is one that is drawn initially from the SOS-QI resources, fantastic resources, but also informed by experiences that the students had in practice. Students will then discuss ways to improve the environmental sustainability of a health system or a particular patient in this case. And one of the other really important learning outcomes we felt was that all of this should sort of take place in a sort of respectful and inclusive environment, acknowledging the significance and the importance of compassionate care and eco-anxiety. That was something that's become very clear, is that there's a huge array of feelings and perspectives in this space. The next piece is to complete evaluation of the teaching intervention, and we're just sort of designing the evaluation, which will comprise a survey and focus groups that will examine students' understanding of sustainability, but also their preparedness to engage with the issue while they're on their practice placements and to influence change, their sort of readiness to influence change during their placements. So that evaluation will take place after the lecture and seminar, the teaching, and then after the students have been on placement in the summer. And then we've got some additional practice placements going on over the summer with the same trust that hopefully will generate some more content so that we can continue to develop our resources. And final slide. So the key takeaways have been that for us, that partnership has been really, really critical. I feel that went well. We really did work with the students in partnership. And I think that what was so nice about that was that it really was an opportunity to learn about each other's perspectives and learn from and with each other. Engagement was really challenging because we had students involved from all elements of the programmes, which meant they were either doing assessments or on placements or on holiday at different times. So finding times to meet was difficult. The amazing array of literature and resources is fantastic, but also actually slightly overwhelming. You do begin to sort of feel drowning in papers and information. It is a very emotional topic, and I think it's important to acknowledge the differing perspectives and to make sure that when it is being discussed, that there's a real culture of respect and psychological safety. And the great thing about the project from our perspective was that not only did the students on the project, involved in the project, learn about sustainability, but they also learned a lot about sort of pedagogy and curriculum design, which was great. Thank you. Thanks, Ayoma.
Thank you, Lorna. So I'm now going to hand over to my colleague Lucy, who also works at the Centre for Sustainable Healthcare. She's a huge driver of harnessing the power of nurses and midwives in leading and embedding sustainable change. So I'll hand over to you, Lucy.
Oh, thank you. Thanks so much. And thank you everyone for inviting me this afternoon. So I've got a short presentation just to talk you through some of the innovations and projects we've been working on, but I'm going to talk you through. So next slide, if that's okay. And I guess I should actually acknowledge my extreme bias that I am a nurse. So I really do feel as the largest healthcare profession, we should be leading and embedding the change. So probably to many of you already know this, but there's 28 million nurses and midwives globally. If we could harness that power, and if we have impact on patients from cradle to grave, we can influence communities across public health to really make a difference and drive forward the change that we so desperately need to see. And we don't have much time, as we're all very much aware of. So next slide. So why nurses? Apologies to my other medical colleagues, but nurses year on year in the Ipsos Muri surveys are the most trusted profession in the world. People listen to us. They want to hear from us. They listen, they trust us, and we can guide them to make the right decisions for our planet. But also it's not just about that. It's actually we can encourage our colleagues to do the same as well. So next slide. So what are we doing? So at the centre, we were fortunate enough to be commissioned to conduct a survey looking at what was to identify carbon reducing actions and behaviours for nurses. It was a large survey that Ayoma led with their colleague Siobhan, and 90% of respondents realised that they could work more sustainably at work. There was a huge, strong emphasis that they recognised it wasn't just about recycling, which was a huge win for us at the centre. It was about preventative medicine, public health, preventative measures to keep people healthy and keep them away from acute carbon burdens and healthcare facilities, and looking at lean processes as well. What can we do to strip out and decarbonise clinical pathways? Mixed understanding across the group, really wanting to do the right thing, really acknowledging that they need to do something, but not knowing what that was. So a real key driver for education here and raising awareness and giving them the tools to lead that positive change we need to see. Competing priorities, I think that's always the case, but actually if we can demonstrate and educate nurses and midwives to recognise that this is very much part of a holistic approach to delivering care. It's not an add-on, it's not a nice thing to do, it's something we all have to do and embed those changes across every element of our practice. And as I said before, it's a huge potential for us to really do something quite incredible and change the way that we deliver so we have a healthcare system for future generations. Next slide, please. So from the report, I'm not going to read all of this, but it will be in the pack for you to have a read later. But really the big thing that we're probably all very aware, and it's no surprises really from the report, is that we need widespread education and raise awareness. And who better to do that than the largest health profession, as I said earlier, nurses and midwives to lead the way. And that's from the front line right up to budget holders, ward managers, care managers, right up to very senior managers, really bringing about that culture change that we so desperately need to see and encouraging everybody across the health system to work in that way. Role modelling those behaviours and networking and sharing best practice. And as Lorna and Ayoma rightly said, we've got a huge amount of case studies already done. So those small scalable projects, how we can share these across for everyone to benefit. We've already done the hard work and all the methodology to demonstrate the value, but actually then embedding that across the healthcare system is where we'll really, really see that sustainable value embedded. So the hard work's already done. It's about taking that and adopting those practices. Talking about dedicated sustainability roles across all elements of the healthcare system. Wouldn't it be wonderful to have a chief nursing sustainability officer at every trust across the land? That would be my dream, and hopefully we'll get there soon. Education, so really prioritising and role modelling those behaviours across our senior leaders so they open the doors and reduce the barriers to leading that change and innovation we so desperately need to see. System and pathway integration, I've said already, embedding those practices into protocols and guidance. So it's part of everything that we do, everything that we breathe. The NMC are very much on board, looking to embed across the code of conduct, across our proficiency standards and our revalidation processes, and that's kind of ongoing. And hopefully we'll see that soon. So it really will be part of everything that we do. And kind of back from that initiative, so that clinical sustainable practice is those wonderful 4 pillars. We're looking at prevention, patient engagement, lean clinical pathways, and looking at reduction of consumables. So not just about recycling. I think that's the big message we want to say, about stripping out waste in all elements of the health system and looking at sustainable value. So shared learning, making sure we all learn together, which I've already spoken about. And I think where the real value is those small incremental changes to practice can make a big, big difference when scaled up across our workforce. Next slide, please. So where's it been in action? So I was very fortunate, and this is how I started my journey with the Centre for Sustainable Healthcare back a few years ago now, when I went on one of their courses actually, and I learned about the plight of the planet. I learned about the trouble that we're in, and I wanted to help. And I was very fortunate to be in a position that I could co-design a programme dedicated to frontline nurses and midwives to look at how they could lead sustainable change. That was a pilot. We weren't quite sure how it was going to go. I'm very fortunate to have worked with Nuffield Health and at the Florence Nightingale Foundation to design a programme that enabled nurses to lead that change through empowerment, through leadership, but also through giving them the tools, which was SUSQI as well, to measure that impact and give them confidence in what they were doing was making a difference. So I was running a 6-month programme, 18 nurses, frontline nurses, from clinics, from wards, band 5s and band 6s were leading change. And they were very small projects. I won't go through all of them there. Couch covers, you might well have seen, that's kind of seemed to have exploded across that initiative nationally. But lots of really simple things we can do to really change. Looking at kind of de-escalating treatment, that was a really great way to drive change and all those areas of an early discharge. And those 18 nurses over 6 months, this and only across the unit they worked within, this wasn't across scaled across a hospital or an organisation, this was just in their unit, saved a collective 6,281 tonnes. I think we were absolutely astonished by the difference that they made. And as a result of that, kind of fed the way for more projects to come through and more funding. So I guess the key message from that project that we were fortunate enough to share at the ICN Congress is small incremental changes to practice can make an enormous difference. I know I've said that a few times, but hopefully you've got the message. And I think that will really see the rapid change we need to see. We don't have time, unfortunately. We listen to the IPCC report. We've got only 5 years now, which is quite sad, to really turn around and change the way that we are as a human race. Next slide, please. So what are we doing? Well, not one to sit on our laurels, as Ayoma said earlier. We're really pleased to kind of progress the work in empowering nurses and midwives. And I'm really pleased, it's the first time I've publicly announced this, is we've been successful in achieving funding from the Burdett Trust of Nursing. So a huge, enormous thank you to them for believing in our ideas and supporting us in what we're going to do. So we're really proud to say that later this year, we'll be launching a tiered approach, which will look at 1,000 places for frontline nurses, embedding simple SUSQI practices and getting them to lead a project within there. And that's up to 1,000 nurses across all 4 countries, across health and social care. So please do help us in promoting that far and wide. The next tier will be looking at supporting clinical and operational leaders in how do they, with budget responsibility, look at SUSQI methodology, really simple SUSQI to measure that triple bottom line, but also carbon footprinting, so they can look at their service as a whole and look at hotspots and how they can then support their frontline nurses and midwives to lead that change. And then finally, an executive course, the VSMs, looking at how they can influence policy, regulation, and really lead and reduce those barriers across their organisations and share best practice. So very excited, please do support us. We'd love to see many of your individuals coming on the programme, and that's free. I should probably say it's fully funded and accessible to all. So that's it from me. I think just keep leading change, and I'll hand across to Ayoma, who's going to share more of our brilliant resources at CSH. Thank you.
Thank you, Lucy. So I hope that's given everyone a little bit of food for thought, and I just want to run through some resources quickly which might support you along your journey if you're engaging in this process or you're already on it. So the first thing is we have a SUSQI website called susqi.org where we have lots of free resources available. That's for people who are maybe clinicians who are doing projects, students doing projects, but also for educators as well. So you can see there's a Teach Others tab right there at the top. We mentioned the educator pack. So we have this pack that creates pre-reading, there's exercises, there's pre-made slide sets, breakout room worksheets, projects and assessment templates. So as Lucy said, we don't have time to keep reinventing these things. So we've created these things. They're all free for you to access and to adapt and adopt as you want to. As Lorna said, you know, you can use it as a base and then make it more relevant to the discipline that you're teaching. So please feel free to access that as well. We've talked about some short courses. So we have multiple courses that we run. A lot of them are discipline based, but we have technical courses as well. So carbon footprinting for healthcare, sustainability and quality improvement, and teaching sustainability and quality improvement as well. So they're made up of pre-work before you attend a 2.5 or a 4-hour workshop, depending on the workshop that you're coming to. And you get some practical skills and advice depending on which topic it is that you're attending the course for. I think probably all of us have attended the courses and been inspired by them, so that's why we're all still here. We also talked about the academy, which is where we met Lorna really. So this is about truly embedding sustainability into an organisation. We know that it requires, you know, developing skills and confidence at different levels. It requires engaging the right individuals and making strategic links as well. So we created this programme to really support people to do that. We know that sometimes you don't have the capacity, or maybe you feel like you don't have the capabilities. And so this is a package where you get access to some courses, you get tailored mentoring hours depending on what your objectives are for your organisation. There's also quarterly forums where academy leads really share what are their challenges, how they've overcome it, what have been their learning points. And then there's a couple of sort of extra resources as well. So if it's something that you are thinking of but think you need a little bit more support, then please think about applying for the academy as well. For those of you who maybe are already leading the way and have integrated sustainability, you can apply to be a beacon site, and you can see we have multiple beacon sites from around the world. So we're really, really grateful to have these partnerships and be learning from each other. We have a number of networks. We have over 30 networks, which are also free to access, and these are accessible through our Centre for Sustainable Healthcare website. There's a QR code there. There is a network for Education for Sustainable Healthcare. The networks are really great because people share their learning, they share their best practices. Equally, if you have a query, it's really lovely when you see someone write, I'm thinking of doing this, but I'm not really sure. And you get all of these responses of people who are either already in that situation and have troubleshooted that, or can help guide you. So I would really, really recommend joining the networks. You can join as many as you want, but there is an Education for Sustainable Healthcare network as well. And then the final resource is our resource library. So we have collated lots of pockets of good work where people have written up SUSQI projects, or equally they've shared their educational resources. And I think for learners to see sustainability in practice, to see where their ideas have come from, the backgrounds, the methods, and then to see what the tangible outcomes are. So what are the environmental savings? What are the social added values? And what's the financial savings? What's been the result for clinical outcomes? It all helps make sustainable healthcare go from this theory of, you know, something nice that we should be doing to this is real life, this is what people are already doing. And the resource library is great because you can search as per any topic that you're interested in. You know, if you want a respiratory example, you can just search respiratory and you can filter it to SUSQI. And people have written up their projects and very kindly shared those with us. So thank you so much for listening to the three of us talk. And there's some acknowledgements there from Lorna's group and mine and Lucy's email addresses as well. So I hope this has been insightful, and I look forward to questions and comments and hopefully productive discussion as well. So I'll stop sharing my screen.
Thank you, Ayoma, Lucy and Lorna. What an absolutely fantastic group of presentations, and really, really insightful. I'm going to open it up to the floor for some questions. And Lucy, I see that you have responded to one of those questions that was asked. But I just wondered whether or not anybody else wanted to add anything to Lucy's response on this question about the panelists thinking about the use of the terms such as eco-anxiety in teaching and clinical practice. There's a concern that that might be a derogatory term, considering that there's very clear and evidence-based reasons to be worried about the effects of climate change. Lucy, I see that you've got a response there. I just wondered whether you wanted to expand on that at all, or
Yeah,
any
sure,
of the others
happy
wanted
to.
to expand.
I think it's a term that was coined. I think it's to recognise that it's okay to be worried. I think it's okay, and it's okay to be fearful, because when you learn about it, I think we all go through that, the grieving process, that you actually need to acknowledge that it's okay to be frightened, and frightened for the next generation and what's ahead. And then for me, I think it's about turning that fear into hope. I think that's where we as educators or clinicians need to turn that fear into hope, to leading change, so people don't feel desperate and don't know what to do. I think that's where, and so I feel we have to acknowledge it, whether eco-anxiety, it can be, there's other terms that were coined, I think, by the Lancet, etc. But I think it's important to teach that. I don't know what Lorna and Ayoma's thoughts are to add into that.
Yeah, I agree with you, Lucy. I think it is important to acknowledge it, and definitely, I remember when still now, I still feel that sort of fear, but it's about taking that and harness it and changing it into fueling things. I think I feel the same thing when I think about health inequalities. It's it's a genuine feeling that you feel, and we should acknowledge that. And I think there was a survey of about 100,000 young people across the world, and their biggest fear was that they don't know that there is a future for them. And so it's important to acknowledge that feeling, and I think eco-anxiety is the term that it's been given. But however you want to use the terminology, it is very helpful to acknowledge that within the young people that we are teaching.
I agree. I mean, I totally agree. I think particularly if you're when you're leading a seminar where you really want it to be discursive and you want to include everybody, I think it's very important to acknowledge the whole range of perspectives and emotions, to sort of try and make everybody feel part of that session, and just not make any assumptions. I mean, that's sort of what I learned, sort of particularly from this work, is that people do hold very amazing views. And there was one example where people were talking about their own personal practices and sharing examples, and I overheard somebody saying, well, it'd be really nice to have the privilege of being able to afford to have those choices, because they had other concerns around finance and things like that. So I think it's not making any assumptions that everybody's anxious, but it's just recognizing there will be this whole array of perspectives, from people being really very active already in the environment, to people perhaps who haven't thought very much about it for a whole host of reasons.
Thank you. One of the I think, Ayoma, you've answered this, but one of the participants had asked about the availability of the slides. I think there is a huge amount of resources there that are available, and would the slides be available to the group who are on the call? But also, I was just wondering about that educator pack and tools. Are they available within those resources and those QR codes that you've supplied?
Yes, so I think there's a QR code and the website for susqi.org. And so if you go to Teach Others, there's a link there for Educator Pack. You just have to put your email in, because we like to see how many people are using the Educator Pack. But once you do that, you get a password, and then you have free access to all of the resources within that pack. So yeah, please do access it, have a look at it, and use it as you would like to.
Yeah, and you'd mentioned a couple of publications that you'd had from that. Is there any sort of ability to sort of use those resources and the evaluation tools to sort of feed into your future research, or is that not the intention of it?
So the two publications were evaluations from a learner's perspective. We have done one from educators. It's in review at the moment with a journal. So we can definitely share that with the Council of Deans once it's been formalised.
Great. Anybody else got anything else to add? There's a couple of other questions.
Yeah, there's one about what all the projects mentioned today. Oh, it's gone. Based on susqi resources. So yes, all the case examples that we have talked about have included susqi, because that's the basis. It's the tool that we use to implement and integrate into education and training. And there are obviously other elements as well, as Lucy and Lorna discussed. There has to be that foundational teaching on sustainability, the relationship of climate change and health as well. But we find that QI is something that anyway is so distributively taught within healthcare that it's a way of trying to, as we say, try and normalize it and make it not an add-on, but just within current teaching, because you can't just magic up a new module in a new term. So yeah, that's what we found to be very useful.
Yeah.
Lorna.
Yeah, just sort of building on that point, there's the sort of the teaching event that we've developed doesn't talk about specifically quality improvement, because it's a level 4 module, but we will be building it towards the level 6 and level 7 modules, but both have quality improvement projects at that centre, so that they'll arrive hopefully with that ability to sort of really think about sustainability as a quality improvement project. But the students on placement did get involved in quality improvement projects.
Great, thank you. Another question is around this financial crisis or cost of living crisis that we're all sitting and faced with, and it's about sort of how have you got any examples of how you've balanced the SUS-QI projects and made them a priority, particularly in this financial climate that they're in? Have you got any good examples of how people have done that?
I'm happy to go ahead. I've got some real life. So obviously sustainability depends. There's two answers to it. It can cost, you may need CapEx funding to get big projects underway, and when you're looking at retrofitting organisations, hospitals, but actually there's lots of simple things you can do through SUS-QI. And because of those measures, low carbon care is lost for low cost care. And I think there's a bit of a misconception around a lot of the projects you can do won't cost anything, actually may save your organisation money. So that's the hook to get it done. And this SUS-QI model is demonstrates that. And I know, I understand looking at priorities, but that's how a lot of time you get organisations to take on these projects, because they recognise that unfortunately there are still financial drivers, which obviously that's not one of my drivers, but obviously it's important. There's huge amounts of initiatives. I think there's looking at things like the Green Theatre Checklist from the Royal College of Surgeons. Theatres is a huge carbon hotspot, and you're basically swapping out anaesthetic gases, which are quite expensive, for regional anaesthesia. So it's better patient outcomes, you're saving money, and actually you're saving the impact of those gases on the environment. That's one example of many. What other initiatives? Switching off things as a campaign, turning equipment off, that doesn't cost anything, but actually you're going to save financial, your energy bills will come down, your carbon footprint will come down. So it's just being sensible. But obviously notwithstanding that there is obviously investment needed in retrofitting hospitals and those sorts of things. But actually, if you're looking from a SUS-QI perspective, most of them have a financial incentive involved at all the projects that I've seen. Ayoma, would you agree? Just thinking from your perspective as well.
Yeah, a lot of the SUS-QI examples come from a program we run called Green Teams Competitions. So we support hospitals to run within their own teams their own SUS-QI project, from design to development to running it to then measuring the impact. And so from all of them, I think in the long term, being over a year, they have saved money, some tens of thousands, for the bigger projects. Sorry, Lucy, go for it.
Yeah, I was just thinking of the statistics are, isn't it? Their average project challenge saves trusts £59,000, about 56 tonnes of carbon per project. So that's quite significant. We've got the research to back that up, but not figures that I've plucked out of the air. So I'll pop them and share them as a resource for you to have a read. But the green challenges are brilliant. I think they're. I'd encourage every organisation to do them, if I'm honest.
I think it's trying to tackle that preconception that to work sustainably, it's more costly. Yes, there is sometimes an initial investment, but actually the returns are so much more, not just financially, also, for patient experiences. Sometimes when we're streamlining pathways, that means an awful lot to them if they're not having to come into hospital 4 times and you manage to do what you need to within 2 hospital visits. And then also the environmental savings as well. So it's getting that information out there, I think, is what we need to do more.
Yeah, absolutely. I think, part of our role as health professionals is to really educate the public about changes in practice. What would you say we would need to do, or you as an organisation might need to do, or as health professionals need to do, to sort of educate the public around these changes in practice? Lucy?
I don't mind going. Do you want to jump in again? I can answer kind of two ways. From a nursing perspective, I think it's about talking to them about the state of the planet, thinking about how they get to the hospital, looking at travel. And I think it's just giving patients gentle nudges about prevention and education about their disease processes. I think, whichever specialty you work within, you'll know your patients, if they look after themselves, they're not going to need as much intervention, which is a lower carbon footprint. So just educating them that way. Another way, kind of, if you look more personally, what can you do personally at home? I really love the Real Zero, bit of a plug there for them, but they've got the 7 steps changes you can make to your life. So thinking about swapping your energy provider, your banking, all these simple things you can do at home to make a difference. And I think that's where we'll see the change. And I think as healthcare professionals, we're registered professionals, we're obligated to educate our patients on the right decisions. And it's just gentle nudges and getting them to look after themselves is kind of the first part of that. Ayoma and Lorna, I'm not sure if you want to build on my response.
I suppose I was thinking about making sure that our learners have the skills to engage in those conversations. So thinking about motivational interviewing, behaviour change techniques to be able to sort of really bring some of that into it is another aspect, I suppose, to be able to do that effectively. So I would see that as a really important element.
Yeah, and I think increasingly there are more resources to support healthcare professionals in those conversations as well. The Royal College of Physicians recently published their Green Physician Toolkit and included a section on how to talk to patients about this. I think the World Health Organization have also published something, and Teddy Porter did a really nice video of having conversations where you're talking about something else, but there is relation to climate change. So for example, if you're doing a COPD consultation and talking about air quality, how patients can keep themselves safe in heat waves and things like that. I think from our perspective also as an organization, it's about collaboration. So working with those higher organizations to try and push this to the forefront, working with public health organizations to try and have more joined up plans, I guess, to scale and spread these things.
Yeah, absolutely. I think from an HEI perspective and from a Council of Deans perspective, we're looking to see how we can support HEIs to sort of embed sustainable education into the curricula. So what small changes would the panel recommend to allow programs, healthcare education providers to do this without creating massive curricular change? What sort of things could we do as a council?
I think we have an obligation to be aligned to our regulatory requirements with the CQC and HIS and HIW, depending on where you work within the country. I think giving a basic understanding of the significant threat of climate change to everybody who comes on any programme is a very first step, and that's aligned to our regulatory requirements. So I think and you can do that fairly. You could do that as an introduction, your first year programme. That's like your foundations. And then you could build on that knowledge and integrate it. I guess to Lorna's point, Lorna made a brilliant point earlier, was actually using the language, changing the way that you deliver and using a sustainable lens to describe how you deliver projects. So if you're delivering innovation or you're delivering, you could think about how could we do this more sustainably and integrate different projects and case studies to demonstrate that impact. So it wouldn't have to be whole curricular change. Well, it'd be lovely to see whole curricular change, don't get me wrong, but what you could do initially would be there's small changes. We've got the resources, so use it, please use it and integrate it into practice.
Absolutely. Lorna, do you want to come in at all, or Ayoma?
I think it is that sort of not being bold about making small change, not having to do something that's perfect, not having to do a big project, but thinking about implementing it at quite a small level. Just engaging in some way means that everybody's knowledge and understanding starts to sort of change. So your perspective changes, and then you start to see opportunities where perhaps you hadn't thought about them before. I mean, I'm now speaking from real personal perspective, thinking on an institutional level, just including sustainability, in, I don't know, quality requirements. If somebody wants to make a module change, you know, to have actually a question that says, have you thought about sustainability, to make sure that it's there in assessment rubrics, you can very, very quickly change the emphasis without, and I think you also, as well as doing sort of subtle things like that, you obviously have to be more explicit as well. But I think there's easy ways to just sort of infiltrate it. And I guess it's about having shared resource as well. So for example, at King's, there is a sort of entry level module on about sustainability. It's not specifically focused on health, but it's there for people to start thinking about it. And again, there's more resources. And then tiny little pockets of funding, you know, these aren't huge amounts of money, but I suppose it's really good to be able to reward your students for engaging in a project like this and not expecting them to sort of give their time completely free. I think those things are important. But I guess having shared, it's also this idea of not reinventing the wheel, to have those shared resources and to sort of share them generously.
Yeah, absolutely. And you've already got me thinking, Lorna, about how I can encourage people to use sustainability in the QI module that we've got in the programme. So that's really got me thinking about that. So thanks for that. Ayoma, have you got anything else that you want to add?
I think it would probably be building off what Lorna mentioned. We have this educator evaluation, and I think the key things that made it successful was also acting on opportunity. You know, when there was a curricular change, that was the time to actually think, okay, let's talk about this and see how we can integrate sustainability. It was really based on whether they had organizational support, so if they had the resources and the time. But then also what made sustainable healthcare not just us QI implemented but embedded was by making a start, you develop this community of practice, this self-sustaining community of practice where, you know, the projects that first year intake came up with were the ones that were then shown to the future years, and people would go on to join sustainability groups or to networks and present at conferences. And so you just develop this kind of rolling, ongoing practice that doesn't necessarily need so much for you to be an expert in it. It just, you need to have the interest and make the time, I guess, for the learners to be able to talk about these things and to understand the principles of sustainable clinical practice and SUS-QI. And people are already worried about this in their personal life. And so when you think about it in your professional standing, you see what opportunity you really have to make an even more significant difference. So yeah, I think just try and start somewhere, and you'll find that lots of other people are in the same boat and have been in the same position. You don't have to reinvent this. You just need to find those resources that work for your situation in your context.
Yeah, it's that snowball effect. Thank you very much. So we've got 2 more questions and 5 more minutes. So hopefully we'll get through both those questions. It's absolutely fascinating discussion. But just the first one is about policy changes, and how do policy changes at the national level support adoption of sustainable practice? What's your view on that?
It's almost the chicken and the egg. You know, like, are we waiting for policy change before we start to work sustainably? I think it probably isn't going to uniformly happen as quickly as we'd want to. So actually, sometimes that bottom-up approach of change is more effective. Yes, it would be great to see every sustainability in all regulations and good practices and within hospital policies, for example, when we think about PPE use. But I think that we need top down and bottom up at the same time. So my feeling is, yes, that would be wonderful in an ideal world. That's exactly what we would have already. But as Lucy alluded to, you know, the time is ticking, and I think we're all sick of sitting around waiting for change, and we want to see it and we want to make that change now. That's just my opinion. Lucy, Lorna, I don't know if you want to add to that.
I've got a more positive, this might surprise you, but I do think we're fortunate to live and work in the UK, is that we are leading the green revolution in healthcare. We're the first health system to put it into statute, haven't we? It's now in the Health and Social Care Act 22. So, you know, there's change happening, not quick enough. I completely agree with that. So we have to be the change we need to see. But it's, you know, I think we're fortunate that we're pushing on an open door, and the work that the Greener NHS is doing is quite phenomenal, and it's impacting the whole health and social care ecosystem. So, you know, there's great work. I just think we need to work a bit quicker. That's kind of what I'd like to see.
Absolutely, absolutely. And I think that bottom-up approach and, you know, sort of framing it within this sort of climate justice, it's becoming more and more of an obligation that we have to do something rather than a nice to have. And I think that's absolutely right. Laura, do you want to come in at all?
Well, I was just thinking that sort of, I agree with everything that Ayoma and Lucy have said. I guess, you know, that bottom-up approach by just raising awareness, improving knowledge and understanding, hopefully you're equipping more and more people to sort of create an agenda, a drive to sort of change, influence policy. But I think we have the agility to not have to wait, though obviously some policies would also be good.
Yeah, absolutely. So the last question is something that's very close to the Innovation and Pedagogy Group's heart, is about AI and the increasing use of AI. Is that something that concerns you, you know, from an environmental perspective?
I've had lots of debates about this, and there's a short answer. It depends where the electricity is coming from to cool those servers that they're providing that AI technology. I think it was something in the news this morning, wasn't there? I read briefly a headline. So yes, it could be used to, as technology advances, to progress patient care, and but it's acknowledging that there is a significant impact. I don't know if you're looking at ChatGPT and things like that, you know, looking at research, and I read something about that yesterday. Using it for research, it's the energy used. And I think I read an article recently about robots within surgery. In theatres, they use a huge amount of power, but again, it's that point: is where's the electricity coming from that's powering those robots? Is it coming from renewable resources? Then okay, that's okay, but can we confidently say that? I don't know what the answer is to that. But mixed. I think I'm mixed.
Anybody else want to add to that, Ayoma or Lorna?
I didn't feel I knew enough to say that, but I mean, I think, yeah, the energy source is probably where most of the emissions are going to come from. So I'm not sure.
I don't feel I have enough information. You know, I feel that I'm still grappling with AI in terms of the best way to support our learners to work with it as effectively as possible. And I'm afraid I don't know huge amounts about it, sort of in terms of, you know, usage and the sort of things that Lucy was just talking about.
Yeah, it's a brave new world out there, isn't it? It's something that we're all grappling with, I think, about AI and, you know, the positives and negatives associated with it. Well, I'm afraid I've got hundreds of questions that I could ask you, but I'm afraid we've run out of time. And it's been an absolutely fantastic webinar, and thank you so much, made by the panelists that have been here. And so thank you so much for your contributions and your really insightful work. And the resources that you have developed are absolutely fantastic. And I see that you don't have any of those beacon sites in Scotland, so I'm going to go out there and try and find one for you. But Ayoma, Lorna and Lucy, thank you so much for your contributions and your insightfulness. And the slides will be shared by Council of Deans and any other resources that we felt would be useful for our listeners. So thank you so much to you all.
Thank you for having us.
Yeah, thank you.
Thank you. Thanks very much.